Okay, we are live. Good morning, everyone. Uh-oh. Want that, that's true. Oh, yeah, no way. We'll have mine.
Exercise, good exercise.
Yeah.
Keep your joint
Yeah, right. Practice.
Yeah.
Alright, now I got the cameras working. Okay, so over the weekend you had chapters 8 and 9 to do. 8 was on nutrition, 9 was on rehabilitation. Does anybody have any questions? Anything that you didn't understand why the right answer was the right answer?
God bless. No.
Yes, you.
Let's take it.
Okay, let me go ahead and get your scores then. This is going to be for chapters 8 and 9. Marwa,
90 and 100.
thank you. Bobby,
90 for both.
thank you. Kathy,
100 and 100.
thank you. Taylor, Toya, Jade,
95 and 100.
do you have 7 for me?
Yes, 95.
Thank you. Dylan,
100 for both.
thank you. Ezekiel, Veronica,
85 and 90.
thank you. Danielle, Antea,
I didn't do them.
that's fine. Katie, Stacy, Corey. Okay. All right. There's only one class left.
Went fast.
Yeah, you guys graduate on Wednesday. Remember sitting here on the first day, I told you it was going to go really fast?
It did.
It really does, yeah. So on Wednesday, we're going to have graduation. You need to be in uniform. I do take a class photo. You'll need to return your yellow book on Wednesday, so bring that back to class. And we're going to go over some employment information on Wednesday. I'm going to talk to you about how to renew your certification, continuing education, how to find a job in healthcare, because it's a little bit different than other industries. Some things you need to know about the interview. And we're going to craft our very own, good morning, we're going to craft our very own tell me a little bit about yourself answer.
Okay.
That's specific to you. So a lot of information to cover on Wednesday as well. Remember that you do have this room available to practice in on Wednesdays and Thursdays from 1 o'clock until 4. Game show will be not tomorrow, but a week from tomorrow. We'll have another game show. So you probably want to tune into that so you can see the type of questions you would get on the state exam. So that's going to be at 11 a.m. on our YouTube channel. That's the only place you can get that is directly on our YouTube channel. It's live and you have the opportunity to win prizes. Nope. Okay. So this is the point in the class that you guys all start thinking about where you want to work. And the biggest thing that I want you to understand is that different places are going to require different tasks. So as CNAs, we learned how to do bathing, dressing, grooming, toileting, mobility, all of those skills. But they're not all going to be used in every setting. It depends on what your patients that you're caring for need from you. So there is a setting for every personality. And you need to kind of figure out where you are going to thrive. A lot of students, when they come in, they all want to work at the hospital. That's like their immediate goal. But that's not a good setting for everyone. And we have to think about the requirements of each setting. So if you're the type of person that likes to get to know your patients and you develop relationships and you don't want a whole lot of supervision, you want to just be able to go in and get your job done, you want the same thing every day to establish a routine, then a nursing home or an assisted living facility might be a good option for you. If you're more along the lines of working with technical things, a lot of machines in a fast-paced environment, working closely with a team, then a hospital or a rehab might be a good option for you. If you want very short patient encounters, then a walk-in clinic or a doctor's office might be right up your alley where you're focusing on vital signs. If you like working with patients in a slower setting where you can really spoil your patients and give them a lot of that one-on-one intensive care, then home care or hospice might be a good option for you. So I have a quiz to help you figure out where you are going to fit in healthcare. And it's on the replay page, flcnatraining.com. It's on there. It's also on my main website. But you probably want to spend a few minutes. It only takes maybe 3 or 4 minutes to go through this quiz. And then at the end, it's going to tell you your workplace setting, but why. And it'll go over some of the features of that workplace setting, like the pace, the pay, the opportunity for advancement, how closely you work together as a team. So it's going to go over all of that information to help you develop a better understanding of the different workplaces that you might find yourself working in. So we do have that available for you. So I told you last class that there would be no more review. So I'm not reviewing with you today. If you want to review, go back and watch the last class. We're going to jump right in to instruction today. And that's going to give you the most practice time at the end of today. But remember, you always have the replay of the last class that goes over the reviews. All right, so if you look on page 147, we're going to get into how to help somebody with a bedpan. So today is all about mobility skills. All right, so if you look down the side here, you'll see that there's no new principles to learn. We know everything we need to do to successfully complete this skill. What we have to focus on are the skill-specific steps, and that's what we're going to get into here. I do have a video for this. If you look down here, this is your test-specific information. Somebody with your level of experience should be able to complete this skill in 10 minutes or less. So that's putting the patient on the bedpan, taking the bedpan out from under the patient, emptying it, and cleaning it. Good morning. But if you look down here, you'll also see that this is going to be done on a live testing student. So that means that you might be a patient for this skill. You are not actually going to pee in the bedpan. Nobody's going to take your clothes off. You are going to remain fully clothed. They're going to put a gown on over your clothing. But somebody is going to put a bedpan under you, and they are going to take it away. So, but nobody's going to be up in your personal space. Okay, so this is, it is a live skill, but it is somewhat simulated in that you're not actually going to use the bedpan. Good?
Yes.
All right, so page 148 gives us our step-by-step directions. And let's look at the care plan at the top of the page. The care plan says the resident has requested a bedpan. The resident is not wearing undergarments and is able to wipe self. So let's stop there for just a second. The reason this care plan says that is because you are going to be a patient for this. And they don't want anyone trying to pull your clothes off or clean you up after the bedpan is removed. So because the care plan says this, now the evaluators can say to you, if you start trying to take somebody's clothes off, stop. The care plan does not tell you to do that. Okay. So what do we know about the care plan?
Follow the care.
We have to follow it. Absolutely. It'll surprise you how many people are there to take the test that have no idea what a care plan is.
What?
A lot of schools just teach how to do the skills. That's it. So if you don't understand what a care plan is or how important it is, you're probably not going to be all that successful at the state exam. Does that make sense?
Yes.
All right, then it goes on to tell us the resident is able to move as directed. So this is an easy skill. Your patient can do whatever you ask them to do, lift their hips, roll on their side, however you want to approach this. We're going to put a bedpan under the patient. We're going to take the bedpan out from under the patient. We're going to empty it and clean it and put it back away. There's nothing here that's earth-shattering. But we do have to talk a little bit about positioning, because that's really where the hard part of bedpan comes in. And to understand this, I'm going to give you a visual. If we have a patient who's laying in bed, just like this is our patient, this is our bed, and we put a bedpan underneath their middle, what does it do to their middle?
Raise it up.
Raises it up. How many of you ladies can pee uphill?
No. You have to sit them up, position them.
Right. Now, if you think peeing uphill is hard, how in the world are you going to have a bowel movement uphill?
You can't.
So putting the head of the bed up is the single most important step for this skill. You guys understand that?
Yes.
We've got to get our patients in a normal elimination position. If you put a bedpan under the patient and you leave them like that, they're not going to be successful. And even if they are, think about that for a second. If a female patient is successful and pees, that pee is not going to go in the bedpan. It's going to go right up her back and into her hair.
Yeah. Then you gotta give her a bath.
And that's pretty gross on anybody's gross meter.
Yes.
So the single most important step for this skill is to get the patient into a sitting position after we put the bedpan under them. But once somebody's sitting on that bedpan, you can't pull it out from under them because their whole body weight is pushing it down. So at the end of the skill, we have to lower the head of the bed to be able to get that bedpan out. So good? We're going to put the head of the bed up for them to use it, put it down for us to take the bedpan away.
Slide it out.
So all of this movement of the head of the bed is going to make whatever's in that bedpan slosh around a little bit. So what could we put on the bed that's waterproof and absorbent?
Barrier.
Yeah, a barrier, an underpad, just in case, and chucks, just in case we get spillage. Does that make sense?
I've seen someone put like a plastic bag over the bedpan, and then when the patient is done and everything, it's just easy to grab and throw away the plastic bag. Is that okay or no?
So I'm going to refer you to your facility policy and procedure on that.
Okay.
We're not going to use that for the test. We're just going to use a bedpan. We're not going to line it with a plastic bag. And it's going to depend on your facility as to whether that is an allowed action. There's two competing schools of thought on that. So you'll go by your facility policy. Okay. There's some controversy on that topic. All right. So do you guys understand the head of the bed? Do you understand why we have to have a chucks under the bedpan? That chucks is going to do one more job for us though. When we're done and we pull that bedpan out from under the patient, we can't carry an open container of urine through a room. First of all, it's an infection control problem. If you trip on your shoelaces, you're going to go face first into that bedpan. So that's an infection control problem. But it's also a privacy issue. Nobody needs to see what's in that bedpan. Toileting is a very private event. So when we pull that bedpan out from under somebody, we're going to take the chucks with it. So the bedpan and the chucks together. We're going to cover the bedpan with the chucks to take it over to the bathroom so that we can empty that bedpan, clean it, and then put it away. Good?
Yes.
Any questions on that? So the chucks is going to be there to protect the bed while the patient goes. And then at the end, when we pull the bedpan out, we're going to take the chucks with it and just cover that bedpan with the chucks.
So before after we put the bedpan, we will raise the head.
Right. Right. So we're going to talk about that right now. Okay? All right. So we're going to follow the care plan, and our care plan tells us the resident is able to move as directed. So I can ask this patient, can you lift your hips up, please? That's the easiest way to put bedpan under somebody, is to get them to put their feet flat on the bed and lift their hips, kind of like that bridge position. That's the easiest way to get a bedpan under somebody. If somebody can't lift their hips up off the bed, though, we can turn them on their side, put the chucks underneath them, just like we made an occupied bed. Put the chucks there, put the bedpan against the butt, and roll them back over on top of the bedpan. So you can put it under somebody that way as well. So you can have them lift their hips, or you can have them roll on their side, put the bedpan, and then roll on top of the bedpan. Now, if you're using the roll method, after they use the bedpan, super important that you hold that bedpan flat as they roll off of it. Otherwise, the whole bedpan's going to tip. Okay, good? But for the test, we're going to make it super easy. We're just going to have them lift their hips up to put the bedpan in place, and they can lower their hips onto that bedpan. Good? All right, let's talk about bedpan real quick. This really is a last resort. I mean, it's truly a last resort. The nurse is going to assess the patient, but the doctor is actually the one that orders how the patient's going to toilet. This comes from the doctor, not the nurse. Even though the nurse is going to have input into it, it's coming from the doctor as an order. So the first thing that we're going to look at is the patient continent? Like, can they hold their urine? If they can't hold their urine, then they're incontinent. We're going to do peri-care every 2 hours around the clock. That's what we learned last week. But if they are continent, now we got some bigger problems. Okay, how are we going to take care of their toileting? Because we know they're going to have to go. Everybody has to go every day. So can they get up and go to the bathroom on their own? Maybe. There are some patients that take care of all their own toileting just like you do. When you have to go pee, you get up, you go pee. I'm not involved in the situation. And some of your patients aren't going to be either. We call that bathroom privileges. That means that they go when they want to go. Now, sometimes your patients can go to the bathroom, but they might need some help. Maybe they need some help with getting there. Maybe they need some help while they're there. In that case, your order would be bathroom with assist. So they go to the bathroom, but somebody's got to help them in some way. Now, if somebody can't get all the way to the bathroom, then we have a portable toilet that we can bring to the bedside, and that's what is over there beside the sink. That's a portable toilet, also called a bedside commode. So you may have a toileting order that says bedside commode, and that means patient does it all themselves, but we'll have to empty that bed or that commode once it's been used. We empty and clean them as CNAs. Your order might say bedside commode with assist, and that just means they need some help transferring, or they need some help getting on and off the commode, or they need some help getting cleaned up after they use it. Okay? So we have bathroom with assist, we have bedside commode, and we have bedside commode with assist. And those are our top 4. That's how we want to take care of toileting issues, because that's as close to normal as we can get. Okay? Now, if none of those will work for whatever reason, then we have to start thinking about plan B. And plan B is, does the patient need a catheter? Now, we don't put catheters in just for toileting convenience. It doesn't work that way. Catheters have a very high rate of infection risk. So we don't use a catheter if the pee can come out naturally. We only use it when we absolutely need a catheter. So the last thing on the list is a bedpan. That's it. There's nothing after that. So we have to go through all of that to get to bedpan. And we need to understand why that's important. Bedpan is a last resort. Now, there's a couple of reasons for that. Number one, they're just not very comfortable to use. It's not a normal elimination process. They're plastic, they're under your butt, they're just not comfortable. But another reason why bedpans are not successful is that we've been trained since we were this tall, don't pee in the bed. Don't pee in the bed. Don't pee in the bed. And certainly don't poop in the bed. So because you were trained from this tall, your brain isn't really going to be able to overcome that very easily and allow your body to go. So just because we put a bedpan under somebody doesn't mean they're going to be able to use it. This may take 2 or 3 or 4 attempts. We put the bedpan under them, they say, I can't go. 20 minutes later, they hit the call light, I gotta pee. We put the bedpan under them and they try for a little bit and they say, I can't go. We take the bedpan out. 20 or 30 minutes later, they say, let me try again. We put the bedpan under them. So this is going to take a lot of patience on our part, understanding that there is a psychological restriction here that's very hard to overcome. But there's also a privacy issue with bedpans because you're not in a private area. Sure, we've got the curtain closed, but that curtain doesn't do anything for sound or for smell. And if that patient has a roommate in the room, that can further restrict their willingness to go. If somebody can hear you peeing into the bedpan, it can affect you. Does that make sense?
Yes.
So bedpans are used for females for both urination and bowel movements. And bedpans are used for bowel movements in men. For men, urination is going to be done in something that looks like a milk jug, and it's going to collect the urine for men. It's called a urinal, and it's just kind of like a handheld plastic milk carton, milk jug. So men won't use bedpans for urination. So once we have an order for a bedpan, the patient says, hey, I need to use it. What we're going to do is prepare the bed first and then put the bedpan in place. So we're going to use that whole clean rolls toward me, dirty rolls away process that we learned. So I'm going to take that chucks, roll it toward me, and I'm going to put it underneath the patient. Now, I know my patient isn't wearing undergarments. No matter what my eyes tell me, what does the care plan say? They're not wearing undergarments. So do I want to put my bare hands under somebody's bare butt?
No.
So what do I need?
Gloves.
Gloves. So I'm going to have gloves on when I put that chucks underneath the patient. Good? Then I'm going to get my bedpan and put it on top of the chucks. Now when we put a bedpan in place, this is our bedpan. The big end, what looks like a toilet seat, is where the butt goes. So this is going underneath their butt. Imagine sitting on this. That would not be comfortable. So when we put the bedpan in, we've got to make sure we put it in the right way. So this end goes under the patient's butt. But the problem is that we have to put the head of the bed up. And the head of the bed is going to bend right where the patient's butt is. So when we put this in place and then we put the head of the bed up, it can slide up or it can slide forward because you're trying to put something flat on a bend. So you can tell the patient they can adjust it as they need to, or you can help them adjust it. But be prepared for that. Let's talk about this table for a second. Every skill that we've learned so far, I told you to put a barrier on the table and put your supplies on the barrier, and you can do that with this skill. It's not a problem. I personally will not do that. You're not going to see me do that for this skill. I leave the bedpan in the drawer until I'm ready to use it, because this is the patient's eating surface. And even with a barrier on it, it's still pretty gross to have a toileting item on an eating surface. So you'll see me keep this bedpan in the drawer until I'm ready to use it. That's the best place for it. But if you want to put a barrier on the table and put all your supplies on the barrier, that's fine. You can do that for the test. So when we put the bedpan under the patient, of course, we need gloves for that. We're going to slide the bedpan in with a wider end toward the back. And then we're going to put the head of the bed up. But we know those gloves were just under your patient's bare butt. So you've got butt juice on those gloves. Do you want to touch that bed controller with butt juice gloves? Or not? So let's take those gloves off to put the head of the bed up. Once you've done that, we'll give the patient their toilet paper and their call light, and we're going to leave the area. Now, for the test, you have nowhere to go. There is nowhere for you to go. So we're going to go on the other side of the curtain, and we're just going to stand there and wait. In a clinical setting, do not stand there. Your patient does not need an audience. This is hard enough without an audience. So in a clinical setting, we would wash our hands and leave the room. But for the test, we can't do that. We're simply going to stand on the other side of the curtain until the patient says, I'm done, or I'm finished, or beep, beep, like the call light. And once that occurs, we're going to come back around and get the patient ready to get off of the bedpan. So we'll put the head of the bed down.
Bless you. Excuse
Bless you.
Sorry.
That's okay, allergies. We'll put the head of the bed down. We're going to put our gloves on, and then we'll take the bedpan and the chucks out together. Take it over to the bathroom, and then we're going to dump it in the bedside commode or the toilet, whatever your testing center is using. There's nothing in the bedpan. We're going to pretend there is. Okay, so we'll dump our pretend urine in the toilet or bedside commode. And then we're going to rinse the bedpan and dump that rinse water into the toilet as well. Now, once we get all of that done and we get the bedpan put away, your patient wiped themselves. They cleaned themselves up. I know that because the care plan told me. So we know where their hands have just been. We need to make sure that they have an opportunity to wash those hands in some way after using a bedpan. So for the test, we're going to give them a hand wipe and let them wash their hands. Good? All right. Do you think that I want to touch that hand wipe container or the hand wipe with gloves on? We don't really want to do that. We don't want to contaminate that hand wipe container. So take your gloves off first. But when you collect that hand wipe, oh, I don't want to touch that. I know where their hands have been. So I'm going to get a paper towel to collect that hand wipe and throw it away. Make sense?
Yeah.
Okay, and then we can remove that privacy blanket, pull the sheet back up, and then do our closing. Let me talk to you about this real quick. For the test, you're simply going to use the sink. We'll rinse the bedpan, dump the rinse water in the bedside commode. Simple. But in a clinical setting, we have something even better that we can use. This is a toilet from a hospital. Up here, you can see the little, looks like a little shower head. If you pivot that forward, it just, there's a pivot point here. If you pivot that forward, it'll sit right over that toilet bowl and it will spray water into the toilet bowl. This is called a bedpan cleaner. And it will clean the bedpan right over the toilet, so you're not using the sink. It's a little more hygienic. These are great. You're not going to see them in every single setting, but there's a problem. We have water under pressure hitting a flat plastic surface. You're going to get splashback. Yes. So we want to protect all of our holes from that splashback. So if we're going to use a bedpan cleaner, you want a mask with a face shield so that nothing can splash into your eyes, nose, or mouth. And you want to cover up your uniform with a disposable gown. So if we get any splashback, it's not on our uniform that we're wearing in and out of patients' rooms. So if you're going to use a bedpan cleaner, we have to dress for the job. Good? Make sense? Okay, so let's talk about that splashback thing. When your female patient is sitting on a bedpan, you've got the undercarriage here and you've got the bottom of the bedpan here. There is not much room there. Pee is under pressure when it comes out. So that pee doesn't have far to go before it hits a flat plastic surface. So when your patient is using a bedpan, they're going to get splashback. It's just a fact of life. Now, this patient can clean themselves up, thank God for that, but in a clinical setting, we're probably going to have to help them a little bit because they may not be able to reach. They're sitting, right, on a bedpan. They may not be able to reach. So we're going to help them however we need to help them in a clinical setting. For the test, we don't have to do any of that. Care plan says they can clean themselves. But there is something that you can use in a clinical setting to make this a little bit easier. Remember we talked a little bit about intake and output when we talked about feeding? You guys remember that? Where we measure the amount of fluid going into a patient and the amount of fluid coming out of a patient every shift. If your patient is not on intake and output, you can put big loops of toilet paper in the bottom of the bedpan, and that will absorb the urine. It cuts down on the sound as well, but it absorbs the urine. It helps prevent that sloshing,
And the splashback.
and it helps prevent splashback. So you can put big loops of toilet paper in the bottom of the bedpan if the patient is not on intake and output. But if we're measuring their urine, we can't soak it up. That's not going to help us a bit. Make sense?
Yes.
Good?
Good tip.
There's one more thing that you can do if the nurse allows it. Those bedpans are plastic. Your patient's going to be sitting on them for a couple of minutes. Anybody ever sit on a car seat that's leather or plastic? You know, like in your car. You ever sit on a seat that's leather or plastic in the summer with shorts on?
You sweat.
You don't just sweat, you stick.
Yeah.
So that's what's going to happen here. When we put that bedpan under our patient in their body heat, remember 98.6 degrees, it's hot, guys. On top of that plastic bedpan, they're actually going to stick to it. So when we try to take that bedpan away, we're going to have to use a little bit of oomph to get that bedpan to unstick from your patient's butt, from their skin, and that can just cause sloshing everywhere. So if the nurse allows it, you can sprinkle a little bit of cornstarch or baby powder on the seat part of the bedpan before you slide it under the patient, and that allows it to slide out super easy. Now, we can't use that if the patient has an open wound, an incision, or a respiratory problem. So this has to be approved by the nurse. Okay? But those are two tricks to make it just a little bit easier when we're working with bedpans. but you would want to go by your facility policy as to whether those are allowed. All right, so when we put the bedpan under the patient, you want to position it. Now, we know the head of the bed is going to move. We know that we're putting it right on that crease, but you want to position it a little bit more forward rather than a little bit more backward. So when you're putting that bedpan in place, people tend to put it way too far back. You don't want the top of this bedpan to be at the small of the back. It needs to be a little more forward. Because when we put that head of the bed up, it's going to slide. It's going to shift. All right, so here are our important parts of this skill. We're going to ask our patient to lift their hips. You can also ask them to roll. We're going to put the chucks under the hips. We'll position the bedpan under the patient. Remember, a little more forward. We'll take our gloves off and put the head of the bed up. Give them their call light, their toilet paper. When they're done, we'll put the head of the bed down, put our gloves on, and take the whole thing out. Chucks, bedpan, everything. Take it to the bathroom, empty it in the toilet, rinse it in the sink, empty the rinse water in the toilet. We'll store the bedpan, same way we store all other basins. We'll remove our gloves, give them a hand wipe, remove the privacy blanket, put the sheet back up, and do our closing. This doesn't take 10 minutes to do, although they give you 10 minutes to do it. Remember, your patient will not be on the bedpan for very long at all. Pretty much as soon as you walk on the other side of the curtain, they're going to say, I'm done, because they're not actually going. So let me show you the video for this one because it's got good close-ups. Good morning, guys. Good morning.
Hello.
Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
Good, how are you?
Wonderful. I understand you need a bedpan. Can I assist you with that?
Sure.
I'm going to close your curtain, wash my hands, get my supplies, and I'll be right back. Okay, I'll need a chucks and a privacy blanket for this skill. Okay, Mr. Jones, I'm going to place this privacy blanket over you. This will help keep you warm and protect your privacy as we do this skill. Is that okay?
Yes.
Okay. I'm going to spread this out without snapping it or shaking it. And I'll have you hold this in place so I can pull your sheet down. That way your sheet remains clean as we do this skill. Okay, I'm going to prepare a chucks to place under you before we put the bedpan in place. I'm going to hold the chucks up lengthwise and roll it toward me. Clean rolls toward me, dirty rolls away. And I'll just place this on the bed. I'm going to open the drawer that the bedpan is in and get a set of gloves. Okay, Mr. Jones, in just a moment, I'm going to ask you to bend your knees, lift your hips as high off the bed as you can, and I'm going to unroll the chucks underneath you. Okay?
Okay.
All right, go ahead and bend your knees and lift up. Okay, and you can relax. I'm going to go around to the other side of the bed and unroll it. Okay, Mr. Jones, can you lift up again, please? I'll smooth the chucks out, making sure it's positioned properly on the bed. You can relax. Okay, now I'll get the bedpan out from in the drawer. And I'm going to place this under your bottom, if I can get you to lift and relax. Is that comfortable?
Yes.
Okay, I'm going to put the head of the bed up, but let me remove my gloves first.
Okay. Okay, I'm gonna put the head of the bed up. Please tell me when you're comfortable.
Okay.
And you may have to adjust that bedpan a little bit as it moves. Tell me when you're comfortable.
That's good.
Okay. Here's your toilet paper and your call light. And I'm just gonna wait out here until I know when you're done. Okay, Mr. Jones, I understand you're finished. Let me help you with that. I'm gonna put the head of the bed down now. And please do not lift your hips.
She's eating grapes.
Once the head of the bed is in the lowered position, I'll put on a pair of gloves.
Okay. I looked. We're in the right place.
And I'm gonna hold that bedpan flat as you lift off of it. Okay, Mr. Jones, I'm going to take a corner of the chucks and hold the bedpan flat as you lift off of it. You can go ahead and lift on the count of 3. 1, 2, 3. Thank you. I'll remove both the bedpan and the chucks and take them to the bathroom for disposal. I'll be right back. Once I get over here to the bathroom, I'm going to unwrap the bedpan and we'll throw the chucks away. I'm going to empty the contents of the bedpan into the toilet and then I'll rinse the bedpan. We'll deposit the rinse water into the toilet as well. And then we'll set the bedpan down to dry. I'll pick it up with a paper towel. I'm going to dry the inside. We'll throw that paper towel away. I'll dry the outside, throw that paper towel away, and get one for the drawer. Okay, I'm going to place the bedpan in the drawer along with the toilet paper, and we'll use the paper towel to close the drawer. Now I can remove my gloves. Mr. Jones, would you like to wipe your hands? Thank you. Okay, you can relax your legs if you'd like. And I'm going to pull your sheet up and remove the privacy blanket. We want to make sure that we roll the blanket in a ball so that any trailing edges don't contaminate other surfaces. There you go. Here's your call light. I'm going to go put this in dirty linen. I'll be right back. Okay, Mr. Jones, are you comfortable? Is there
Yes.
anything else I can get for you while I'm here? A
No.
magazine,
Thank
perhaps?
you.
Your call light is there. Please let me know if there's anything that we can do. I'm going to open your curtain and go wash my hands.
Thank you.
After washing my hands, I'll review the steps of my skill, make any corrections, and then tell the evaluator my skill is done.
Okay. Okay. And then Sarah.
If you stand up, it might clear your airway a little bit better. Yes.
I noticed that in the video you didn't put a barrier on a table, whereas in this book it doesn't show a privacy blanket. So
Oh, the book doesn't have privacy blanket on
no,
it?
it doesn't mention the privacy blanket.
Okay, I'll
They
have,
don't want like it to fall into the bedroom just in case like they move.
no, it's just a step that unfortunately got skipped when I wrote the book. So I'll make sure that I add that in. Thank you for notifying me of that. All right. So any other questions? Any other questions on that? Okay, so now we're going to move on to catheter care. This is a long skill. Somebody with your level of experience should be able to do this in 15 minutes or less. Very, very, very similar to pericare. Very similar. All of the principles to perform this skill we already know. We're going to follow the care plan. We'll do our opening. We need some gloves. We're going to use a barrier because we have supplies. We'll use a privacy blanket. Linen rules apply. Scoot and roll. Remember, you always want the patient in the middle of the bed. It is a washing skill, so your washing rules apply. We'll clean the basin the way we clean everything else, and we'll do the closing. Along the bottom here, this is test-specific information. If you look at who the patient's going to be, this is going to be done on a mannequin. You're going to talk to the mannequin just like she was a real person. The evaluator will play the voice of the mannequin and answer you. So you will get an answer, but you do want to approach this like it's a real person. All right, so page 159 has our care plan at the top of the page. It says provide catheter care with soap and water to a female resident with an indwelling urinary catheter. Clean the catheter tubing and perineal area only. So that means that we aren't cleaning the backside. We're just cleaning the peri area and the tubing. So this is very similar to PeriCare. But with PeriCare, we clean the peri area and the backside. For this, we're going to clean the peri area and the catheter tubing. That's going to be the difference.
So at CNAs, we don't do the catheter, but we do the cleaning part of it.
Right. We're going to talk about our responsibilities here in just a second. Yep. But no, CNAs do not put catheters in. You do not take catheters out. Our responsibility is to clean the catheters. Now, that being said, remember we talked on day 1 about delegation and learning new skills, depending on the setting that you're in. So if you go to work in a outpatient surgery center and you are in the post-op section where these people are going to go home, a lot of times when we do surgery, we put catheters in because we relax everything when we put you to sleep for surgery. So chances are you're probably going to pee all over our sterile field because everything gets relaxed. So a lot of times during surgery, they put a catheter in once you're under anesthesia, and that just keeps the surgery area clean. But we have to take that catheter out before you go home. So as a CNA, if you're working in the post-op area, the facility may have in their policies and procedures that you can be trained to remove catheters in that setting. Now, training doesn't have to be in a classroom. Training can be at the bedside. It can be in a trainer's office. It may not be in a group. It might be one-on-one. But the facility is going to determine what skills they believe can be delegated in that setting. Good? So for the most part, basic CNA, which is what we're covering, you're not putting catheters in, you're not taking them out. But in some settings, you may be trained to do additional skills. Always be open to gain additional skills. Now, let's say that happened to you. Let's say that you went to work at a same-day surgery center, you learned how to take catheters out, and then you leave that position and you go to work at the hospital. And you tell your supervisor at the hospital, hey, I know how to take catheters out. Well, just because you've been trained and you know how doesn't mean you're going to be allowed to do it there. Okay, good?
Yes.
Okay, so that's going to be employment specific. So along the bottom here, you can see all of the supplies that you need that are very, very similar to catheter or to PeriCare. We've got step-by-step directions that tells us exactly how to do this skill. And this is really, really similar to PeriCare. So with PeriCare, we put chucks underneath the patient. We cleaned the peri area, middle, side, skin fold. Whatever we wash, we rinse. Whatever rinse, we dry. We turned the patient over. We cleaned their backside, up the middle, one cheek, the other cheek, up the middle. And then we changed that pad again at the end. So that was PeriCare. Catheter care is very, very similar. We're going to put a chucks under the patient. We're going to clean the peri area, middle, side, skin fold. Whatever we wash, we rinse. Whatever rinse, we dry. But instead of cleaning the backside, we're going to clean the tubing. And we're not going to leave the patient on a clean chucks at the end of the skill. There's no need to have a chucks there. The catheter is collecting the urine and shuttling it away from the patient. We don't want to put a chucks under a patient that doesn't need one. Chucks are going to hold in body heat because they're plastic. That's going to make the area warm. It's dark because it's under the patient. And then because the patient is warm, they're probably going to sweat.
More bacteria.
And then we have warm, dark, moist. So unless we need a chucks under the patient, we don't want to put one there. Okay? Good? All right, let's talk about catheters themselves. We're going to clean the catheter once per shift or as directed by your care plan. But usually it's going to be once per shift. While you're cleaning, you also want to inspect the tubing and the bag to make sure that it's hanging from a non-moving part of the bed. Make sure that the tubing isn't kinked, that the urine is flowing freely, and the bag isn't anywhere near the floor. We also don't ever want to raise the bag above the level of the patient's hips. So let's talk about the different parts of a catheter and bag system. These are two separate pieces, the catheter and the bag. The catheter is what's inserted into the patient. It's this thing. The bag is what's going to be connected to the catheter, and its job is to collect the urine. So the catheter gets connected to the bag through a port right here. The catheter collects the urine. The bag stores the urine. The next skill we're going to learn is how to empty the bag. That's our last skill. All right, so let's talk about the parts of this. Oops, I'm back here. Let's talk about the parts of this. So this tip right here has a hole in it. You can see that here. This tip is what's inserted into the bladder. This is done by a nurse. But we're putting it into a hole that already exists. We're not drilling anything. It's not a surgical procedure. We're not creating a new opening. The opening is already there. It's your urethra, the tube you pee out of every day. So they insert this tip of the catheter into the urethra until we get to the bladder. Now, in females, the bladder or the urethra, the tube that goes from the bladder to the outside world, is only about as long as your pinky. So that's not very far to insert the catheter. It's only about as long as your pinky. Now in men, the urethra is significantly longer because it has to go through all of that penile tissue as well. But in females, that's a very short distance. That's important for us to understand because, no problem. That's important for us to understand because we need to be aware of the infection risk here. Now, every bacteria is trying to find a bladder to get into. And that's because bladders are the ideal breeding environment. A bacteria don't need little boy bacteria and little girl bacteria to have baby bacteria. It doesn't work like that in the bacteria world. All they need is the right conditions and the right food source. So inside the bladder, you've got proteins and enzymes that make bacterial procreation much easier. So it's already warm, it's dark, it's moist. We have that already. But then we have these enzymes and protein molecules that allow these bacteria to zip themselves in half, and now we have two.
Multiplication.
That 2 will become 4, and that 4 becomes 8, and so on until you have an overwhelming infection pretty quickly because of this exponential multiplication. So if your patient has a catheter, the name of the game here is not allowing any bacteria into this system. This system is closed. As long as we don't let any bacteria in, we're safe. But the problem is that when we work with a catheter and a bag, we have to open this system, and that it allows for the possibility of bacteria to enter. So this part goes into the patient. Once it's in there, it's not really a risk to anybody because it's inside the patient. Bacteria aren't going to get in to the catheter there because it's inside. We're going to hold that catheter in place using a balloon. I'm going to show you that in just a minute. And then we have the catheter tubing itself. Down at the bottom of the catheter, we have 2 ports. So this is a catheter with the balloon intact. We have 2 ports down here. One port allows us to put water into the balloon and take water out. The other port attaches to the back. So when a catheter is inserted by the nurse, it's inserted flat, no balloon. So we put this catheter in place. Once it's in the bladder, we know it's in the bladder because we get urine out. Once it's in the bladder, we would take a syringe and use sterile water to inflate that balloon, and that's going to sit right on top of that valve at the bottom of the bladder, and it acts as a doorstop. It keeps that catheter from coming out. Now, if you didn't have this balloon, as soon as you let go of the catheter, it would slide right out because there wouldn't be anything to keep it in place. Good?
Yes.
So this port, the one with the color on it, is how water is going to be put in. And when it's time to take the catheter out, we use a syringe. We remove the water. And then that catheter just slides right out. Okay. All right. The bag is going to attach to the other port. This is what's going to allow the urine to go through the bag tubing and into the bag itself. There are markings on the bag here and here. We don't use these markings to measure the urine. We're actually going to put the urine in a measuring cup to measure it. This just kind of lets the nurses eyeball. CNAs don't use this. And then over here, we have the emptying port and the house it lives in. Now, this is going to be important to us in a few minutes because when we learn to empty this bag, this is the one place that bacteria can enter. When we remove this port and we open it to allow the urine to come out, we can introduce bacteria into this system. And that's a very, very, very bad thing. Because there's nothing in that system that will prevent that bacteria from multiplying. There's nothing there to stop it. We don't have white blood cells in that system. So the catheter and the bag are 2 different pieces, and that's because the catheter can stay in place for up to 30 days before it has to be changed out by the nurse. So this would be long-term use of the catheter. It can stay in place up to 30 days. But the bag itself is going to be changed usually once a week or as directed by your care plan. So because the catheter is going to stay in way longer than the bag is used, we have to have 2 separate pieces there. Now, CNAs can be trained to change out this bag, but it would require additional training. Because if we allow bacteria in from this port, when we empty it, that bacteria has a long way to climb. I mean, it's going to climb. That's a long way to climb. But if we let bacteria in here, when we change out the bag, that is not a very long way for bacteria to climb. So you have to be trained to change this bag out and minimizing bacterial contamination. It's not a sterile procedure, but it's one we call clean. You've got to be very careful with that. So CNAs are responsible for cleaning the catheter, the skin around the catheter, emptying the drainage bag, and documenting output. You can also be trained on changing the drainage bag. You can also be trained on inserting and removing catheters in some settings. But as a general rule, CNAs don't do that. You guys remember this? Chain of infection? Right, we have a pathogen. That pathogen has a place to live. It has to have a doorway out, and then it's got to have a way of traveling. Once it travels to the new place, it's got to have a doorway in, and then that person has to be susceptible to infection. So this is why catheters are not used routinely. Because unfortunately, there's a very high risk of infection here. And we actually have a special name for this. It's called a catheter-acquired urinary tract infection, or you'll hear it called a CAUTI. A CAUTI. And CAUTIs kill about 2,400 people a year. It's significant. Now let's talk about why. This is a normal functioning urinary system. We saw this last week. We have 2 kidneys. They filter blood 24 hours a day, create urine. That urine drips down tubes called ureters into the bladder. And then there's a valve in the bladder that, when closed, holds urine in the bladder until you go to the bathroom. The valve opens, the urine comes out. You guys remember that? Okay, so this is what happens when we have a catheter. When we insert the catheter, all it's going to do is hold that valve open, and it collects the urine and diverts it down a tube and into a bag. That's all the catheter is doing. So if I have a patient who needs a catheter, as a nurse, I'm going to take my catheter. It'll be attached to a bag, and using sterile technique, I'm going to insert that catheter up into the bladder. Now I know I'm in the bladder when I start to see urine come through here. So I insert this catheter into the bladder. Once I see urine, I inflate that bulb, and that holds the catheter in place. Good? You guys see how that works?
Yes.
This is a little weird question. Do they have the sensation of like knowing they have a catheter, or do people have the sensation that they need a pee?
Yes, so let's talk about that. Okay? So if I have let me just use this graphic to show you. Okay, our bladder expands. So more pee, it expands. It's kind of elastic. Well, if we keep the bladder empty, it's going to be really small. There's nothing in it to expand it. So if we have a catheter in place, the top of the bladder is actually going to be down here. The top of this catheter is going to hit the top of the bladder. Now, the top of the bladder has nerve sensors. And the only thing that's ever hit the top of the bladder, ever, is pee. That's it. That's the only thing that's ever hit the top of that bladder. Nothing else in your entire life has ever hit the top of that bladder. So when the top of the bladder feels this catheter tip, it's going to think it's urine, pee. Absolutely. So the top of your bladder sends a signal to your brain, says, hey, we're full. And your brain says, oh, we must have to pee. So your patient with catheters will often feel like they have to pee. That sensation goes away at about 10 to 12 hours. So have them get involved in a movie, read a book, distract themselves in some way, and that sensation will finally go away after about 10 to 12 hours. Okay. Telling the patient just go, well, that means that they have to bear down, and that's not really going to help at all because the valve is already open. So you're not really helping your patient. In fact, you could probably be pushing that catheter out by bearing down. We don't want to do that. So just tell them that's okay. You're going to feel that for a little while, but it will go away. Better yet, go tell your nurse, hey, they feel like they have to pee. Let the nurse go through the mechanics of that. Okay. Does that make sense? Now that's different from pain. If your patient says, ow, this hurts, go get the nurse right away. Pain is never normal. We don't want pain. This should not have pain associated with it. Might be a little discomfort. Might feel like something is there that doesn't belong. But pain is different. Have you guys ever had a Charlie horse in your leg?
Yes.
You know how bad those hurt? Well, in some people, a very small percentage of the population, in some people, when we put a catheter in their bladder sees it as a foreign object and it spasms to try to get rid of it. Now, this is a Charlie horse of the bladder, and it hurts. So if your patient says, ow, 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 it hurts, it hurts, it hurts, go get the nurse right away. Now, the nurse is going to have to figure out how to solve this problem. That's not our job. Not our job.
So we leave the patient. We walk away.
Yeah, leave the patient. Just tell, I'm going to go get your nurse right now. I'll be right back. Okay? Go get the nurse. Tell them the patient is complaining of severe pain, and the nurse will go in and solve the problem. I've only got two options here. I can either take the catheter out, which would solve the problem. But if I need the catheter for some reason, then we have a medication that we can put the patient on that puts their bladder to sleep. So they won't feel that anymore. The problem is that medication has some side effects. And one of the potential side effects is the bladder never wakes back up.
Basically.
Ever.
You don't want to do that.
Then that would mean we're permanently on catheter.
So we've got to weigh some pros and cons here and try to figure out the best solution for this patient. Okay. Does that make sense?
Yes.
So our role as CNAs is to notify the nurse of everything our patient tells us. Whether it's, I feel like I have to pee, or it really hurts. Our job is just to let the nurse know, and the nurse will solve that problem. So when we have a catheter in place, we're holding that valve open and we're diverting the urine into the tube in the bag. That's all the catheter does. There's nothing magic here. Nothing magic at all. It's nothing more than a straw. In fact, way back, when medicine was in its infancy, we used to use glass straws.
Boy.
Yeah. So, and then they realized that if you cover the top, it goes in easier. So that's how we have the modern shape of the catheter.
It looks like the head of a needle.
And
Like, a sewing needle. Anyway.
in a way, yeah, in a way.
There it does.
Yeah, because it's got the hole
The
in it.
hole in the middle, yeah.
So the valve is held open by the catheter. The urine is diverted into the catheter, the tubing, and it's going to be collected by a bag. Now, there's a couple different bags that can be used. They both work the same way. They both attach to the catheter. It doesn't matter which one. They both attach to the catheter the same way through the same port. This is a bedside bag. That's what we have here. That's what you're going to use for the test. It is a large bag, holds a lot of urine. It's called a bedside bag because it hangs on the side of the bed. And we use this when our patients are in clinical settings. But if your patient is out in the community walking around, they don't want to carry a suitcase of urine with them. That's just a little odd. People will stare. So we have a different kind of bag. This is called a leg bag. And it's smaller, but it attaches to the inside of your thigh or your calf with elastic straps. Again, it's going to attach to the catheter the same way, and it's going to divert the urine, but it's much more discreet. It can be hidden under clothing. There are people right now in our community walking around with catheters, and you have absolutely no idea that they're there because they're hidden under clothing. Usually with leg bags, patients will handle this themselves, but CNAs can help with them. Usually bedside bags are what we're going to deal with. Okay. Good. Depends on the setting you're working in as to which bag you're more likely to encounter. I used to work with some very severely functionally disabled children. And we used to take them to all different places. to Busch Gardens, to Disney World, to different parks and things like that. Well, several of them had catheters, and we would generally use a leg bag when we're out in public because it's less obtrusive, less noticeable. So a leg bag is going to attach through these elastic straps to either the thigh or the calf, depending on the comfort of the patient. So here's the problem with catheters and bags. If, when we're emptying the urine, we let bacteria into this bag, there's nothing there that's going to stop it. It's got urine. It's got enzymes and proteins. So those bacteria are going to split in half and a half again and a half again, and they're going to build up. And as they build up in this bag, they're going to start climbing. And they're going to climb into the tubing and eventually into the catheter. Now, if that bacteria is able to get into the catheter, now it's warm, dark, because this is all clear. It's not dark. So once it gets into the catheter, it's warm, dark, moist, and food. So now that bacteria is really ramping up. And by the time it gets into the bladder itself, that bacteria invasion can be overwhelming. This patient would go from fine to really, really, really sick in like 30 minutes. Because you're not talking about one or two bacteria invading. The one or two bacteria was way at the bottom of the bag. They have multiplied on their journey. So it's 1 or 2 trillion bacteria that are invading like that. Now remember, we generally don't put catheters in healthy people. So their immune system, otherwise occupied. So we just gave them an overwhelming infection with no military in sight. Do you see how this could significantly impact our patient's health?
Yes.
So as CNAs, our job is to make sure the catheter stays nice and clean. The skin around the catheter stays nice and clean. And when we empty the bag, we're not allowing that port to touch anything. So there's no bacterial contamination. Good?
Yes.
So there's 3 points of entry that bacteria can invade through. One is the tip of the catheter. That's the nurse's problem when they put it in. The second one is where the catheter and the bag join. You have to be trained to change that bag out because of this bacterial risk. And then there's the port that we empty the urine through, and that is our job. So we have to learn how to empty this bag without allowing any bacteria to enter. So bags should always be on a non-moving part of the bed, and they should always be above the level of the floor. You never want a bag to touch a floor because, again, you've got that bacterial risk. So we don't let the bags touch the floor. We also don't want those bags above the level of the patient's hips because now you've got recycled urine going into the patient, and that's pretty gross. Even if it's your own urine, it's still pretty gross. So never lift the bag above the level of the patient's hips. I watch a lot of like health shows, and it's so funny because you'll see these CNAs or PCTs or techs walking patients down the hallway, and they'll be carrying the urine like this. And it's like, don't do that. That urine's going right back up into the patient, along with whatever bacteria might be in that catheter or that tubing. You're just washing it right into the bladder. So never allow that catheter or that bag to go above the level of the patient's hips. The tubing should always be coiled on the bed, not near the floor. If you have tubing that's near the floor, your feet can get all tangled up in it or somebody else's feet and pull it out. Patients often pull their catheters out, especially dementia patients, because it doesn't belong. It feels weird. It's foreign. And your dementia patients will absolutely pull it out. But unfortunately, CNAs pull way more catheters out than patients do. And that's because if we are going to turn a patient over in bed If you trap that catheter between your leg and the bed, when you turn the patient, you'll pull it right out. When you transfer a patient out of bed and into a wheelchair, if that catheter bag is on the other side of the bed, you'll pull that catheter out. If you're walking a patient and the bag is hanging on the chair and you stand the patient up and start to walk them, you'll pull that catheter. The only thing that's holding that catheter in place is a water-filled balloon. That's it. You pull hard enough, it will come out. But now we've got a balloon this size going through a tube this size.
Oh, it's gonna be painful.
So you're going to get some tissue tearing, which means you'll get a little bleeding, some urine, maybe even a little mucus. Your patient is okay. They're not going to die from this. But can you imagine peeing through that tissue, that torn tissue? How would that feel? Oh, it's going to burn like fire. Yeah, so as the nurse, I need to know about this right away. If that catheter comes out, I need to know because I only have about 45 minutes before swelling sets in. And if this area gets swollen, I'm not going to be able to get another catheter in. Now that patient has to pee through that tissue. There's no other choice. So I have to make some decisions before the swelling gets bad. If a catheter comes out, don't hide it. Don't leave it for the next shift to handle. Don't conceal it in any way. Go let the nurse know. Yeah, you might get a lecture on safety, absolutely, and you probably deserve it if you pull the catheter out. But don't hide it. Good. You'd be surprised how many dislodged catheters are found at shift change because CNAs try to hide it. It's bad for the patients. So tubing should never be coiled near the floor. It's got to be coiled on the bed. Your feet will get tangled in it and you will pull it out. You have to be careful when you're ambulating or moving patients at all. If a catheter is in place, that catheter has to go with you. So look for a catheter before you move a patient in any way. If a catheter does come out, we don't want to just throw it away. As a nurse, I got to figure out what kind of a problem I have here. If the whole catheter comes out and the tubing and the balloon are intact, that's an easy problem to fix. But if the catheter comes out and the balloon has a hole in it,
Change that.
that means that a piece of this catheter might still be in the patient. And that is a much bigger problem. Now I've got to get a doctor to come in and go fishing. We actually put a camera up there with little grabbers and we go fishing in the bladder to try to find the piece of catheter that's left. If we don't, the patient could end up with rejection of that foreign body, which will initiate an immune response. So as a nurse, I need to look at the catheter and the tubing to make sure everything is intact. So I'm going to pass these around so you guys can see. This is probably the best one. So this is the one with the hole. That's the intact. So what do we do with it? If we don't want to throw it away, what do we do with it? Well, on the bottom of every trash can is going to be some unused trash cans or trash bags. So it's going to be under the bag that's open. Just move that bag, get a new bag out, put the catheter and the tubing, the bag with tubing in that bag, put it in the bathroom, go get the nurse. Hey, the catheter came out. It's in the bathroom for you to inspect. The nurse will inspect it and then she will discard it. But if you go throw it in soiled utility with all the others, I have no idea whose is whose and I have no information to work with. So there's a couple of different types of catheters. This is the one that we've been talking about so far. This is called an indwelling catheter. Its other name is a Foley catheter. Everything in medicine has two names. Everything in medicine has two names. So it's called a Foley catheter or an indwelling. It's going to have that balloon on the end of it that keeps it in place. It's designed to stay in place for a certain amount of time. But sometimes we don't need that catheter to stay in place. We just want to put it in, get our urine sample, and take it out. In that case, we don't need a balloon. We're going to use this. This is called a straight cath. It's also called an intermittent cath because you put it in and then you take it out. It's also called a red Robinson, which is, it's red. So this is a different type of catheter. It has a hole at the top. It has a hole to collect the urine at the bottom. It's nothing more than a straw. What it doesn't have is the balloon to keep it in place. But it functions exactly the same.
Who would they use that one for then?
So this is going to be when we want a urine sample from somebody and they can't pee. Particularly if we want a sterile urine sample. Have you ever heard of spina bifida? Okay, spina bifida is a condition that babies are born with sometimes where their spinal cord is on the outside of their spine. A lot of times it's on the outside of the body. Babies with spina bifida often have difficulty controlling that valve to open and close their bladder. So these children would need to catheterize a few times a day to bypass that valve and let the urine come out. So these children get very, very good at something called self-cath. So they are able to put their own catheters in, drain their bladder, and then take those catheters out. These catheters are used for that as well. Then we have this type of catheter. This is called an external catheter or a Texas catheter. It's also known as a condom catheter because it does resemble a condom. It goes on the same way. It has this tip here, which is the same type of tip as what we have here. So it would connect to a bag. Same concept. But this goes over the shaft of the penis rather than inside. So it does reduce the amount of potential infections for the patient. So it's a little bit safer from an infection risk. But these are designed to be kept in place for up to 3 days. And that means that we're going to have urine, adult urine, right up against the skin for 3 days. So this can eat the skin. Remember, our adult urine can be very acidic. This can eat the skin. So when we have a Texas cath in place and we remove it, we've got to make sure we're doing really, really good cleaning and skin care. And you'll probably have a skin prep, a pad that we're going to put a solution on the tip before we put a new catheter on that just adds a layer of protection to the skin. But again, you're going to follow your care plan. So 3 different types of catheters that we deal with routinely. This is the most common, indwelling. This is occasional, intermittent. And then this is an external for men. So when we're doing catheter care, we're going to clean the peri area and the tubing. So the peri area is cleaned the same way we did peri care. My washcloth here. But when I'm doing the peri care part, I want to hold that catheter out of the way. So I'm going to pick the catheter up and kind of hold it out of the way. I'm going to go down the center, fold this leaf down one side, fold the leaf down the other side, fold the leaf, skin fold the leaf, skin fold. Whatever we wash, we rinse. So this is exactly the same as what we learned with peri care. Always go top to bottom, away from the urethra. Whatever we wash, we rinse. Whatever we rinse, we dry. Now when it comes to cleaning the catheter, remember this part of the catheter is inside the patient, right? So we can't see this. This is inside the patient. But if we tug on this catheter, it's going to hurt. So when we're cleaning the catheter, we want to hold it where it exits the body. So when we
surround it with a washcloth and we wipe away from the body, it's not pulling on the inside. You guys see that?
Yes.
It doesn't pull on the inside. So you want to hold that catheter tubing where it exits the body as you wipe away. We're going to wipe with 4 leaves. Wipe that tubing with 4 leaves. Whatever we wash, we rinse. Whatever we rinse, we dry. All right, so our steps here, we're going to follow that care plan. It says provide catheter care with soap and water. What are we cleaning with?
Soap and water.
Soap and water. Why are we cleaning with soap and water? Easy answer.
Because that's what.
That's what the care plan says. Easy answer. A lot of people, one of the biggest mistakes made with this particular skill is they do this with an alcohol pad.
Oh, no.
You do not want to use an alcohol pad on sensitive female skin. But
Yeah.
more importantly, it's not following the care plan. If you don't follow the, you are not going to pass. That's why the care plan says soap and water. Yeah, that's surprisingly common during the test. Don't do that. All right, so every skill starts with a knock, or the opening. Every opening starts with a knock. So, knock, knock, knock. Hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to do catheter care. Is that okay? Close curtain, wash hands, and then we're going to get our barrier. We're going to put the barrier on the table, go back and get the rest of our supplies. One of the supplies that we need is water for bathing. So we're going to use a paper towel to turn the faucet on. We're going to check the water temperature with our wrist, and we're going to ask our patient to check the water temperature. We're going to put a privacy blanket on the patient and pull the sheet down underneath. We're going to get our gloves on. The first thing our gloves should touch is the patient, so we want to do all of that prep work first. Once we get our gloves on, we're going to ask the patient to scoot toward us, roll away so we can put that chucks underneath the patient. Once the chucks is in place, we're going to get them back on their back, and we're going to do pericare. So we'll roll that blanket up. We're going to put a towel over their legs. We'll wring out our washcloths, and we're going to soak 5 leaves, just like we did with pericare. We're going to hold the catheter and clean down the middle, side, side, skin fold, and then we will rinse, and then we will dry. Once we've cleaned the peri area, we'll get a new washcloth and wring it out, soak 4 leaves, and clean the catheter itself, moving away from the body. Whatever we wash, we rinse. Whatever we rinse, we dry. And then we'll cover the patient again, restore that privacy blanket so that their privacy is maintained. We're going to remove that chucks from under the patient. We're going to return the patient to the center of the bed so we can clean up all of our supplies. Dirty linens go in dirty linen. Your basin gets cleaned, dried, and stored. All of those ending things, we can remove our gloves then, remove that blanket, and then do our closing. Long skill. 15 minutes. This is a long skill. But the good news is, if you get this skill, you get 2 short skills to go with it. Like range of motion and respirations. 2 short skills to go with it. So it's not that bad. Okay, good? All right. So before I show you this video, I'm going to talk to you, I want to show you how to empty the drainage bag. So we're going to go through that instruction because I want to show you those 2 videos back to back. For the test, they're 2 separate skills. So we would do our opening, catheter care, closing, and then our opening, empty the drainage bag, closing. They're 2 separate skills. But in a clinical setting, you're probably going to do both of them at the same time, because catheter care is done once a shift and emptying the drainage bag is done once a shift.
So generally speaking, they're both done at the same time. So I want to explain to you a little bit about how this skill works, and then I'll show you both of those videos. So drainage bag is going to be on page 164. Again, there's nothing new to learn here. We know all of the principles. Down here at the bottom, they give you 9 minutes to do this skill. That's way more time than you need. It's going to be done on a mannequin. That mannequin will be in bed. And this skill does require documentation. You do have to document how much output we measure. So page 165 has our step-by-step instructions along with our care plan. So the care plan at the top of the page tells us to empty the resident's urinary drainage bag into a graduate container and measure and record urinary output in mLs or cc's on the intake and output form. Remember, as CNAs, we always document in metric. So this is the container we're going to use to measure the urine. This is the container. It's called a triangular graduate container. It's in the shape of a triangle and it has graduated markings. So you'll hear it called a triangular graduate container. And this is what they use during the test. They used to use the ones like this and it was really, really hard to read. You see those little marks? Really hard to read. And then they finally did upgrade to the ones with good visibility. So thank goodness for that. All right, so we've talked about the two different types of bags. We have a bedside bag and a leg bag. Now, these bags, although they work similarly, they are emptied differently. So the bedside bag that I sent around has a T valve. You push the valve to the side to open. You push it back to close. The leg bag is going to have a twist valve. So you would twist it to open and allow the urine to come out, and then you would twist it closed. Please always make sure that you close the valve after you empty the bag. That is a really big deal. Really big deal. Okay. So this is a T valve. Get this out of the way. So this is a T valve. It has a little house that it lives in. When you remove the T valve from its house, you don't want it to touch anything. You want to maintain control over it. Now, of course, you would have gloves on for this. But you remove it from its house. You're going to push the T valve to the side to open the valve. If you look through there, it is open. To close it, you would push it back to the side to close it, and now it's closed. So when I do that, notice I'm always staying below the T part. My fingers are always down here. I'm not doing this. I'm not touching up here. Right? We don't ever want to touch up here. Your hands have to stay below the T. This is an infection control principle that's very, very important because remember, we don't want any bacterial contamination on this. It also can't touch anything. It can't touch the bed, the sheets, the floor, your gloves, the barrier, the cup. It can't touch anything. It's got to remain clean. When you're done and you've closed the valve, you're going to put it back in its house without touching a whole lot of the bag. Now, what we used to do is alcohol this after we emptied the urine. We would just take an alcohol wipe and clean it off. We don't do that anymore because what we found, alcohol is a drying agent in this plastic.
And it cracks it.
Yeah,
Yeah.
was getting micro cracks. Micro cracks allow bacteria to hide. So we've, through studies, decided that it's better to not clean it, just minimize whatever it's exposed to and make sure that valve stays closed unless it's actively being emptied.
Yes, ma'am.
Good?
Yes.
Questions? So this is a T-valve, this is a twist valve. When emptying the drainage bag, we're gonna put the graduate container on a chucks on the floor under the bed that we're working on. This is a skill you're actually gonna have to get on the floor for to be able to empty. You can squat down, you can kneel, any way is fine. Remember, your uniform is not clean once you start work, so touching the floor with it is fine. When emptying the drainage bag, we don't let that port touch anything, nothing. To open the T-valve, we slide it to the side. To close it, we slide it the other way, and then we put it into its empty, or its little house without letting it touch anything. Now, when we take this container over to the bathroom, we're gonna cover it with the chucks, because remember, an open container of urine doesn't need to be transported through the room. And then we're gonna put it on the lid of the toilet. This checkpoint, remember on the test you got checkpoints? This checkpoint says that the graduate container must be measured on a barrier, on a flat surface, at eye level. If you miss any one of these, you've missed the whole checkpoint. You don't get partial credit for this. So we need it to be on a barrier. Well, we have the chucks, that's our barrier. It needs to be on a flat surface, so you can't hold this up like this and figure out how much is in there. It's got to be on a flat surface, and you have to be at eye level. So if I have this on the toilet and I do this,
That's not an accurate reading.
it's not eye level. So I actually need to get down and measure at eye level to get credit for this checkpoint. Good?
Yes, ma'am.
Okay, and then we're going to document this skill. You should document military time. If you don't know military time, I have a lesson in the book on military time that'll teach you how to do that. If you are using regular time, you must put AM or PM. You must. But military time is preferred. Type of output, urine. Don't assume. There's lots of things that can come out of the human body. There's sputum, there's wound drainage, there's blood, there's urine, there's emesis, there's feces. I mean, there's all kinds of stuff that can come out of the human body. We can't just leave that blank. We have to put what type of output. And then how many cc's we measured, and then our initials. One of the biggest errors on this skill is people documenting in the first section. First section says intake. If you document urine under intake, you are legally declaring that this person drank 450 cc's of urine. That is what you are legally stating. So that alone can fail you. Remember, these are legal forms. So we have to make sure we get it right. After we document, we're going to wash our hands. Good? So I'm going to show you these two videos, and then the rest, we'll go on break, and the rest of the class will be practice.
Hi, Miss Jones. My name is Patty. I'm your CNA today. How are you? Good. I need to do catheter care. Is that okay? I'm going to close your curtain, wash my hands, get my supplies, and I'll be right back. Okay, Miss Jones, I'm going to gather my supplies. I'll start out with a barrier that provides a clean place to put my supplies. And we're going to get 4 washcloths, a towel, a chucks, a privacy blanket, And now I'll gather my basin and soap. And a set of gloves. All right, Miss Jones, I'll just get some water. I'll be right back. Okay, would you like to check the water temperature and make sure it's okay? It's good? Good. I'll place the washcloths in there to stay warm. And I'm going to cover you with a privacy blanket. This is going to help protect your privacy and keep you warm while we do this skill. And I'm going to pull your sheet down to about your knees. Okay, Ms. Jones, I'm going to place this pad underneath you. This is going to help keep your bed dry while we do this skill. First, I'll roll it toward me. And place it on the bed. And then I'll put my gloves on. All right, Ms. Jones, can you scoot toward me, please? Thank you. And can you roll onto your left side? 1, 2, 3. Thank you. I'm going to be very careful, making sure that the catheter tubing rolls with the patient and doesn't get pulled on. I'm going to unroll the chucks underneath the patient's hip and have the patient come back onto their back, making sure that they don't lay on that catheter tubing. Ms. Jones, can you scoot to the middle of the bed, please? Thank you. Ms. Jones, can you scoot toward me? Thank you. And roll up onto your right side. 1, 2, 3. And now I can unroll the chucks to protect the bed. Come on back, Ms. Jones. And scoot to the middle of the bed. Thank you very much. Okay, now I'm going to start cleaning the catheter. I'm going to roll your gown up inside the blanket. I will be exposing you, but we'll make this as brief as possible. Please let me know if you're uncomfortable. As I roll the gown in the blanket, I want to make sure that I don't grab the catheter, that we don't cause any unnecessary pulling or stress on that catheter. And now we'll cover her thighs with a towel. This exposes only the area that we're working on. I'm going to take the first washcloth and wring it out and apply soap to 4 leaves. 1, 2, 3, 4. Now I'm going to clean your catheter. I'm going to hold the catheter where it exits the body, wrap the washcloth around, and wipe away from the body. Fold that leaf over. I'm going to hold it, wrap the washcloth around, and wipe away from the body. That's 2. We're going to do this 2 more times. Away from the body. 3. And the last one. 4. I'll set this washcloth aside. Whenever we wash, we must rinse. So I'll wring this washcloth out, and we'll use it to rinse that catheter the same way we washed. I'm going to hold it where it exits the body, wrap the washcloth around, and wipe away from the body. We'll do this 4 times. 2, 3, and 4. Set this aside. Now we'll dry the catheter. Now we're going to do peri-care. We'll take a washcloth out of the basin, wring it out really well, and we're going to soap 5 corners. 1, 2, 3, 4, and the back side is 5. Okay, now I'm going to clean the peri area. I'm going to lift the catheter up out of the way with my pinky and hold the labia open while I clean down the center with the first leaf. always going top to bottom. And then we'll remove the washcloth and fold that leaf over. Now I'm going to clean down one side of the labia, top to bottom, fold that leaf over, clean down the other side of the labia, top to bottom, fold that leaf over. I'm going to clean the skin fold between the groin and the leg, fold that leaf over, and clean the other skin fold between the groin and the leg, and then set that washcloth aside. I'm going to take the final washcloth and wring it out really well, and we're going to rinse all of those areas the same way that we washed them. So I'll hold that catheter out of the way and spread the labia open, cleaning down the center, top to bottom. Fold that leaf over, clean down one side of the labia, fold that leaf over, rinse down the other side of the labia, fold that leaf over. We're going to rinse the skin fold, fold that leaf over, and the other skin fold. Set that aside. Now we'll dry gently by patting dry top to bottom and then removing the towel. Ms. Jones, I'm going to cover you back up. I'll unroll that blanket, which will replace the gown over the patient. I'm going to make sure that the catheter and the tubing is coiled on the bed, not near the floor and not where the patient is laying on it, making sure it's not kinked. Ms. Jones, I'll be right back. I need to dispose of your supplies. The towels and washcloth will be placed in dirty linen. The basin is going to be cleaned the way we clean everything else. We'll return the basin to the drawer, and on the way we'll pick up the soap. We'll open the drawer with the paper towel and return the basin to its storage area. Now I'll dispose of my paper towels. Okay, Ms. Jones, I need to remove the chucks from under you. Can I get you to scoot toward me, please? Thank you. And can I get you to roll up on your left side? 1, 2, 3. Thank you. I'll roll this soiled chucks toward the patient and tuck it under her hip. Come on back, Ms. Jones. And scoot back to the middle, making sure the patient is not laying on that catheter tubing. Okay, Ms. Jones, can you scoot toward me again, please? Thank you. And roll up on your right side. And I'm going to remove that chucks from the bed. Okay, you can scoot back to the middle. Thank you. This is going to be thrown away. Okay, Ms. Jones, let me just look at your catheter one last time. Make sure that the catheter tubing is coiled on the bed, that the catheter is not on the floor. Everything looks good. I'm going to remove the chucks from the table, and we're going to throw this away, and then I'll remove my gloves. We'll throw those away. Okay, Ms. Jones, I'll pull your sheet up now. And I'll remove the blanket as I do so, rolling it into a ball. You put this in dirty linen. Okay, Ms. Jones, here's your call light. If you should need anything, just let me know. Are you comfortable? Can I get you anything while I'm here, like a magazine? I'm just going to open your curtain and wash my hands. After washing my hands, I'll think about the steps of my skill, make any corrections that need to be made, and then tell the evaluator my skill is done.
All right, any questions on that one? No questions? Okay, this is a super short skill. Good enough.
Hello, Miss Jones. My name is Patty. I'm your CNA today. How are you? Great. I need to empty your urinary drainage bag. Is that okay? Okay, I'm going to close your curtain, wash my hands, get my supplies, and I'll be right back. For this skill, I'll need a barrier, which I'll place on the floor under the drainage bag. I'm going to need a set of gloves. And I'm going to need a triangular graduate container. I want to inspect the catheter tubing to make sure that it's coiled on the bed and the patient isn't lying on it and it's not kinked, but also that it's not hanging near the floor where somebody might get their feet tangled up in it and trip or accidentally rip the catheter out. This catheter looks like it's in the appropriate position. We'll now remove the port from its protective sleeve on the bag. Sliding the valve to the side will open the port. We can now position this open port over the graduated container and tilt the bag slightly to the side to allow the contents to drain into the graduated container. While doing so, we want to be careful not to allow that port to touch any other surface. Once the urine bag has been emptied, we'll slide the port back to the side to close it and very carefully insert it back into its protective sleeve. We want to make sure that the bag is hanging on a non-movable part of the bed and it's not touching the floor. We can now fold the chucks over the graduate container for safe and secure transport to the patient's bathroom. Once we're at the patient's bathroom, we're going to set the graduate container down on a barrier on a flat surface and position it so that we can read it. We need to be at eye level, and we're going to round to the nearest line, either up or down. You can see that the urine in this container is nearest to the mark of 425, so the amount that we will document is 425 milliliters, or cc's. Once we've measured it on a barrier on a flat surface at eye level, we can now empty the urinary graduate container. We'll throw the barrier away, open up the toilet, and we're going to dump the contents of the graduate container into the toilet. Now we're going to rinse the graduate container. We'll deposit the rinse water into the toilet as well. Now we can clean. After dumping the rinse water into the toilet, we'll set it down, use a paper towel to pick it up, paper towel to dry the outside, a paper towel to dry the inside, and we'll discard this, and then one for the drawer. We're going to place the graduate container in the bottom drawer and close the drawer with a paper towel. Okay, now I'll throw the paper towels away and remove my gloves. We'll throw those away as well. Thank you very much, Miss Jones. Is there anything else I can get for you while I'm here? A magazine, perhaps? You have your call light there. If you should need anything at all, please feel free to let me know. I'm going to open your curtain, wash my hands, and document my skill. Thank you. After washing my hands, I'll document on the intake and output sheet that the evaluator gives me. I'm going to document the time of output, the type of output, which is urine, the amount of output in cc's, and my initials. After documenting, I'll review the steps of my skill, make any corrections, and then tell the evaluator my skill is done.
All right. Any questions on
No.
that skill? Any questions on anything we've gone over so far? We are now done with all of the skills.
For stuff like this, do most people wear a mask or do you not?
Go by your facility policy.
Okay.
Yeah, every facility is gonna be a little bit different. Go by your policy. Some facilities do make you get in full PPE for this. Others just require gloves. It depends on what their infection control protocol is. Good question. Any other questions? All the skills are done. You guys did good. Congratulations.
Yeah.
All that's left now is to practice. We're gonna go ahead and take our break. The rest of the class will be practice, so you have about 2 hours of practice time today, which is what I told you last week you should have. And remember, on Wednesday, you need to bring your yellow book back, as well as we're gonna take a class photo too. And I do have employers in the area that will, could possibly contact you through your class, through the class photo. So you'll probably want to tag yourself in that photo. So you do have our last chapter of homework tonight, and that's chapter 10 in the yellow book. It's a short chapter. It's on employability, super easy. We don't have the CPR today, and you will be returning that yellow book on Wednesday. All right, so I'm going to go ahead and wrap up our online portion, so you guys can go ahead and take a break, and then the rest of the class is practice. Those of you joining us online, thank you so much. We'll see you on Wednesday for graduation, and then our next session starts in January.
Study sheet.
Happy Veterans Day to everybody that has served. Thank you very much for your service. So until next time, happy caregiving. Bye.
Bye.